Went to the GAO. They agreed with the 2 GAO recommendations. So that, in their formal response to the report, the recommendations that were made. Now, what I'm having trouble understanding, and this really gets down, how do we help you?
Right.
That's what this hearing's about. This hearing isn't to beat up Social Security. It isn't to say you're not working hard. It is how do we find and become the problems that allow us to most effectively help those people who need our help, but not help people who are gaming the system.
Sure.
And I will just tell you, I'm biased when we have 1 in 20 people in this country on disability. I don't believe it. As a practicing physician in a poor area of the country with lots of problems, I don't buy it. So I think there's a lot of fraud out there. We may disagree on the level of fraud. So the whole purpose of the hearing is how do we change, number one, to make it easier for you all to administer. Now, I've been through all the breakdowns of everybody that's getting disability. I know all the factors. I know the amount of schizophrenics. I know the amount of psychotics. I've got it all right here. I know where the real problem. I also know the number that have disability based on anxiety. I'll just relate a story to you. The guy that bricked my medical building was on full-time Social Security. And he was on because he had a bad back. But he heave-hosed those bricks and that concrete and everything else, and he did it to every building in town and continued to get Social Security disability. And he knew he was supposed to report, but he didn't. Now, that may not be fraud to the Social Security system, but it is to the average American in this country. And I think that's where Mr. Chairman, I thank you for that, because we've got to help you make it to where it's easier to help people and at the same time prevent fraud and abuse with the system. And that's what, we're just starting down this area. This is something I'm going to work on over the next 2 or 3 years if I'm here. We're going to clean this up. We're going to make it easier for Social Security to do the job. We're going to give you the tools that you need, and we're going to give you the money so that there can't be a reason for us not doing it. But we have to know what the real problems are.
Sure.
And look, if I was running this and read this report, I wouldn't like it either. And I know it's a difficult area to administer because I know my staff helps people get Social Security disability every day.
Right.
I have 2 people that work on it full-time as a U.S. Senator. And I know the first review is normally you don't qualify. And I know all the setup and how it's gained. So I want to go back. The Arrow program could be helpful, correct?
Yes, I agree, but with a qualification. I think the sense that I got from GAO, and again, you've got a lot of people here, it may be that I misunderstood. I don't mean to be unfair to GAO. The Arrow system as it is generates such a huge amount of information that we can't possibly follow up on the leads that would come from that in any, certainly not in my professional lifetime in the agency. What I think we can do—
Can we stop right there for just a second? Save your second thought. It generates so much information we can't follow up.
Right. So, but
let me go on with that, because I hear that all the time up here.
Yeah. What
we can't do.
Right.
We have technology available today to do all sorts of things that we couldn't do last year.
That's the point I was trying to get to.
Okay, so I think it's important. The fact is if there's data out there, and if we may have a problem, okay, and that's what you're saying, there may be a problem. The fact that somebody wasn't prosecuted, that doesn't mean anything because nobody's going to prosecute them if they fall under a certain dollar. And they're not going to even get referred. I mean, when agency refer to the Justice Department for $10,000, they know it's not going anywhere. They don't even refer anymore. Why waste their time? They know it's not a priority. The other thing, the IRS data you're using is old.
Right, absolutely.
The new higher database is quarterly. But the statement that using that is not cost-effective, I don't understand why that would not be cost-effective for you all. Does it require too much more investment to be able to effectively use it, or is it not cost-effective because it doesn't give you new data?
Sure. So first of all, let me go back to Arrow first. I'd like to complete the thought. And what we're doing increasingly when we've got these millions of pieces of information that has worked quite well for the agency in recent years is work on predictive models. So while we don't think a simplistic response to the Arrow information is going to work, we think that we may be able to build computer programs that can screen through it to try to identify patterns from the data that might be high predictors of fraud. Now, we're doing that already with the rep payee. We have 5 million people who take care of our recipients for us because they're not competent, and we do have some fraud in that area. And the predictive models, we've worked with the National Academy of Sciences. It's not perfect, but it really does allow us to do a lot better.
You're better than you were.
One of the things that we've done to respond to a lot of concern from Congress when I came in, how come this takes so long for the easy cases? There are certain people, and you know, that there really shouldn't be any dispute about whether they're eligible for disability. So we've used computer models now to scan the cases because we're electronic, and we can pull out with a high degree of accuracy the cases that really should be, mostly certain types of cancers, rare genetic diseases, pancreatic cancer, those kinds of things. And we always have a human review because you could go through a medical report and the doctor could say, thank God it's not pancreatic cancer, and that would just show up as pancreatic cancer in the model. So we think that we're going to be able to do that with Arrow. We're not sure. It's a long and complicated project, but you know, I would guess that maybe by sometime toward the end of next year, we'd have a much better sense of whether that's going to be beneficial. For the new hire database, my understanding is that my staff has come to the conclusion that it's not cost beneficial. I think there's a lot of things that go into it. I don't want to get that wrong and inaccurate, so I'd like to submit that for the record if I could.
So you don't think it will be beneficial?
I know that my staff thinks that it's not.
Well, would you do us a favor and submit to the committee why you all, in other words, an analysis of why you think utilizing this data will not be cost effective?
Sure. If I could, actually, I'm getting reminded here. All right, so we have looked at the numbers on this before. I'm jogged my memory. We now allow claims reps, as I understand it, and if I make a mistake, I will correct it for the record, to use it on a discretionary basis when they think they see an issue. And the information, as I understand it before, is we get about a 2.7 to 1 return when we use it on a discretionary basis. When we've used it on a more aggressive basis, it's just above break even, about 1.4 to 1. And if you look at all the other matches that we have and all the other leads that we can't follow up on because we don't have the staff, the return to the taxpayer is much higher following up on some of the other matches. And so that's my understanding of the staff position.
Well, that gets back. One of the things the GAO testified today is this is after the fact stuff.
Yes.
Where you're like Medicare, you pay and chase.
To some extent, Senator Cummings, not entirely.
Okay, but the point is how do we help you on the front end? You know, the phenomenon, we know every time we have a recession, we have a big jump in disability claims.
Right.
Now, did everybody get hurt because we had a recession? Or did people get more disease because we have a recession? Or is it because here's a source of revenue because we have a recession? We started out this hearing, both the chairman and myself, we are committed to making sure those people who have true disabilities that need this country's help, we're going to help make sure that gets there. The question is are we going to allow what we think may be, not is, may be significant, and I'll use the word fraud. You and I obviously have a very different definition of what fraud is. Are we going to allow fraud to steal future from our kids? And so with a large deficit that is the fault of everybody in Congress the last 20 years, not one administration or not one president and not one party, what are we going to do together to solve the problems to get our country out of the hole we're in? So I want to go to, so one of the things we want to know is how do we go on the front end to make it better? And let me ask you a question. One of the things I just asked my staff, my observation in the medical field is there are certain doctors that do Social Security disability exams. Correct?
Yes.
They do a lot of them.
They do.
That's right. Do you ever allocate those with the ones that are truly eligible and aren't? In other words, have you ever done a statistical analysis? Because here's the way it works out there in lots of instances, not all. A lawyer hooks up with a doctor. You give me what I need, I give you a big payment for it, not a bonus payment on getting disability, but you give me what I need, and you can make 2.5 or 3 times on this physical exam if you were versus what you were spending with some other patient.
Sure.
So have you all looked at that?
Sure. Multiple questions. Let me try to answer
Okay.
these if I
Sorry.
can. As I understand it, in the mid-'80s, the courts interpreted the Act as creating something called the treating physician rule that basically said we have to give deference to the doctor chosen by the patient. That's not our choice, so we can't dictate and we don't really oversee.
So you're inhibited by law if you think there's a questionable maldistribution of approvals, you're inhibited by law to have a second exam by somebody of the choice of the Social Security Administration.
We can go, and we do, get second consultative exams. But we have to, as I understand, again, if I get this a little wrong, we'll correct it for the record, but we have to basically overcome the presumption that the treating physician's conclusions are correct. That can be difficult in some cases. So that's my understanding of...
That's fair. Again, that's exactly the thing we need to know.
Yeah.
In other words, if we're really going to help you, fix it on the front end,
Sure.
where we're accurately helping those people who need, but not helping those that don't need, because the one thing that wasn't mentioned, Mr. Chairman, is the trust fund's going belly up in 6.5 years for this one, for the SSDI. And there's no way we change it without doing something major in terms of supplementing it from the rest of the federal budget. So what we have to do is be very accurate. Would you just sit down with your key people and say, you all know the regulations better than anybody in the country. Nobody else knows them like you do. What is it the Congress could do for us that would help us meet the goals of the programs, but limit the capability for us to pay and chase?
Sure. I've got a backlog of answers here for you. Let me get you.
Okay.
So first of all, I don't think that we are as pay and chase as most other federal programs. First of all, by statute, we do a 50% re-review with quality people, quality performance people, not the original reviewers, of all allowances. That's a statutory requirement that a lot of people overlook called pre-effectuation review. And we probably end up saving the trust funds, if I remember correctly, about $800 to $900 million a year through those pre-effectuation reviews. We have on my watch, we are in the process of enrolling the AFI program. So we now have arrangements with banks to track assets, and for the Title 16 program, we will be able to find assets that are hidden. That's also a
You're talking SSI now.
Yes,
Yeah.
that's also a backdoor way of getting at earnings, because if you have earnings, you're likely to be, inappropriate earnings, you're going to be hiding inappropriate assets. And I also do want to, I do think that we've tried to get the Congress's attention on the fine work the Office of the Inspector General has been doing with the CDI programs. I've been out, I've looked at those programs hands-on. I think they're a great investment for the public. And part of what they do is they develop these teams for the people who are looking at these cases on the front end. So if there's a real concern and uneasiness, they can go and they can tap into the expertise of people with fraud. So I think we really do a lot on this task. So I'm not saying we're doing everything we could conceivably do, but I think that we do a lot on the front end to make sure it's not pay and chase. In terms of ways you can help us, certainly, I think, with all due respect to GAO, they underestimate the difficulty and cost, particularly for us, of setting up matches if the other organizations are not required to do so by law. When GAO comes knocking on the door and says, we want to look at your data, we want to do a match, I think people jump much more than when the Social Security
Well, that's the way we can help you.
Yes, that's right. And that's why exactly I'm on the same wavelength with you, Senator, I'm making your point. And I think that could be helpful. As I've looked, and this is, I mean, in the preparation for this hearing, one of the things that I learned is that on the debt collection part, we have statutory barriers to prompt collection. So if we think that there's an overpayment and we're trying, for instance, to collect it from a federal employee, we cannot fully access on a timely basis the Treasury offset program, which is one of our big tools for collecting those debts, sometimes that because of waiting periods that have been established by the Congress and statute. So at least one good thing that came out of the study is I learned that by preparing for today's hearing. And so there are subjects like that that I would have liked to see this report go into in more detail to give specific, concrete things we can do.
I promise you, they're coming back. Mr. Chairman, you're going to want to ask more questions? Well, let me yield back to you, and then I'll follow up after.
Okay. First of all, I'm not sure there is a definition of fraud that is different